Hello, my name is Michael from the University of British Columbia, and together with my supervisor, Professor Robert Xiao, we're delighted to present our work titled Drifting Off in Paradise: Why People Sleep in Virtual Reality. So, sleep is important for all humans. Getting a good night's sleep is imperative for physical and mental well-being, and can influence behavioral factors like learning and memory. However, sleep-related risks are increasingly widespread in modern society, and as such, research has looked at addressing this using technology. One technology that has just begun to be explored as a clinical sleep aid is that of virtual reality. However, there has been limited research in how VR technology may affect the overall sleep experience outside a lab setting. Thus, in this paper, we examine the reasons that people might voluntarily engage in the practice of sleeping in VR, looking to understand the motivations, actions, and experiences that uniquely define this practice. To summarize, these are people who deliberately choose to sleep while using the VR headset, and we find this to be an interesting phenomenon to study because of its experiential applicability towards developing VR as a sleep aid, but also as better understanding the human relationship and potential within virtual worlds in the future. As such, our research questions for this study were: 1. Why do people choose to sleep in VR? And 2. How do people sleep in VR? So, a wide range of prior explorations have been implemented to monitor, track, and assist with sleep, with some examples listed here on the slide. Some very recent studies have begun to explore the potential role of virtual reality and its role in sleep. For example, studies on the effects of VR on sleep quality. However, we take a different approach in the study, and our work more closely aligns with the work of Maloney and Freeman, who were the first to find that people, among doing other activities together, also sleep in social VR. In this study, we largely expand on Maloney and Freeman's initial findings regarding sleeping in social VR by highlighting the complex social dynamics that motivate the practice, the routine and experience of its practitioners, and its present limitations and shortcomings. To address our research questions, we conducted semi-structured interviews with 14 participants who had experienced voluntarily sleeping in VR. We noted that most participants indicated that they used VR chat as the application of choice when going to sleep. The interviews focused on the participants' motivations for sleeping in VR, comparing it to non-VR sleep, challenges and improvements to the experience, etc. The interviews were transcribed and then qualitatively analyzed through inductive thematic analysis. We first reflected upon and familiarized ourselves with the data before developing codes that were iteratively grouped into categories involving themes to motivate our subsequent findings. We first want to paint a picture of how people sleep in VR, starting with how participants set up for this in the real world. As one can imagine, and as participants indicated, it can be difficult to adjust to sleeping with a headset, along with other associated physical complications such as cable management and space limitations. Several participants described specialized setups they would have in order to engage with the practice. For example, having a specific way of lying on their pillows or sleeping on a chair instead. One particular specific issue is that laser-based full-body tracking fails to work with blankets, so some participants indicated workarounds, for example holes in the blanket, whereas others simply did not use the full-body tracking. Now we delve into the virtual world. A user would first look for a specific world to sleep in, which can depend based on social aspects or environmental preferences, which we will discuss later. After going to their desired world, a few participants furthermore emphasized the importance of having their avatar mimic their pose while sleeping to maintain immersion and embodiment. One surprising finding was that while sleeping in VR, the headset is left on, and as such, usually the participants must dim the brightness and lower the volume in order to have a suitable environment to sleep in. Now, moving from the how to the why, we were able to identify two main categories of motivations for sleeping in VR, with the first category being experiential motivators, relating to the affordance of VR in providing an immersive, novel environment. Participants were happy to have the ability to pick their environment to sleep in, which can drastically differ from their typical mundane space. Participants indicated that this provided them with feelings of relaxation and peace, as many of the worlds favored by them were described to be cozy or peaceful. Tied to the ability for VR to transport its users to different worlds is the idea of escapism. This can manifest as escape from physical factors, such as isolating oneself from noisy physical environments, but also from a mental standpoint, if one wants to disconnect from reality or society. Thus, sleeping in VR can allow users to address some sort of discontentment they might have with their current reality. The other main subset of motivators for sleeping in VR revolved around the social aspect of the practice, transforming an oft-private activity into a social one. Participants enjoyed having company while sleeping, and for some, this was their primary motivation for engaging in the practice. Comparisons were made between sleeping in VR and sleepovers, with the ability to stay over, talk late, and fall asleep with others, often friends, sometimes strangers. From a deeper perspective, though, a common theme among social interactions was that of intimacy, a sort of close physical and emotional relationship that participants had with the people they slept together with. This aspect of intimacy exists through gestural communication and presence, such as through hugs and head pats, but also through emotional connections, as some participants indicate that sleeping together could create or enhance feelings of closeness or compassion with their friends. Regarding post-sleep considerations, we note that firstly, for some participants, sleeping in VR is a precursor for a deeper sleep. For others, they spend the entire time sleeping in VR. When waking up from VR, however, some participants note that this can elicit momentary confusion, which can be particularly spooky if they are in a different world from where they fell asleep, something that almost never happens in real life. Regarding self-reported sleep quality, answers were generally varied. Some participants expressed that they believed sleeping in VR could lead to a worse quality sleep due to general discomfort, whereas others indicated that their sleep quality was unaffected. Sometimes they indicated that it was even improved by increased or faster sleep onset. Several participants indicated that they believed that sleeping in VR could have potential therapeutic effects, although this requires further clinical research. So for many participants, the biggest challenge regarding sleeping in VR was the bulk and clunkiness of the hardware. Some participants even indicated potential health concerns, such as the VR headset being too tight on their head while sleeping, which caused them having difficulty with breathing. One participant mentioned that a potential improvement would be to have the experience without a headset, but speculated on whether that would ever be possible. Other challenges related to the improvements within the VR application and software when using it during sleep, relating to the fact that the typical behavior of the headset is to remain online in the same environment during sleep. The constant brightness and volume were irksome to some participants, with some presenting improvements regarding detection methods, for example, automatically detecting when the user has fallen asleep, and then adapting the software to tune this by turning off the display or automatically muting sounds above a decibel threshold. All in all, we find that the motivations for sleeping in VR are disconnected from the actual use of the VR hardware. That is to say, that the motivations relate to the experience, while the challenges relate to the restrictions placed by the VR hardware and software. From a self-determination theory perspective, we find that sleeping in VR falls under the motivational pull of autonomy, so having the freedom to choose where to sleep, and relatedness, having the ability to be socially connected while sleeping. We asked participants to ponder on the future of the practice as well, and while many participants were generally optimistic, they brought up challenges mainly relating to the demographic shift of VR towards children and a more general mainstream demographic. With more users, participants wondered if sleeping in VR would become a practice that is accepted, or whether it develops in parallel towards more mainstream applications but never intersects, staying as a niche thing. The answer to that might provide foreshadowing towards a broader trend between the relationship between human reality and virtual worlds. Thus, to summarize, in our study, we talked to 14 participants who have experience with sleeping in VR. We find that sleeping in VR is motivated through experiential and social motivators, that the practice involves setup in both the real and virtual world, and that future development largely might focus on maintaining or improving upon this experience while addressing the limitations of the VR hardware and software itself. Thanks for listening to our presentation.